So the other big thing I want to ask, though, about this in terms of hormones is testosterone. A lot of testosterone questions, and I feel like I don't know anything helpful to tell patients about testosterone. I know that ovaries do produce testosterone, and I understand that when you go into menopause, your ovarian hormone production goes down. That includes testosterone. Is that, you're nodding, so I'm hoping that I'm somewhat right here. Tell me what you know about testosterone in the menopausal patient and what we can be telling our patients.
That is true. So definitely the ovaries are producing testosterone. The testosterone seems to drop off a little bit later than the estrogen does. So we tend to lose estrogen a little bit sooner and progesterone, and the testosterone kind of drops off a little bit later. I will tell you that my opinion on testosterone has been evolving, and it's still evolving, but here's what we know. We do know that women who are getting testosterone supplementation do feel better in terms of less fatigue, more energy. They have improvements in libido and in muscle mass, so it can be helpful in those ways. We do know there can be side effects to testosterone, so abnormal hair growth, acne, these sort of virilization, things like voice deepening, clitoromegaly, things like that people don't necessarily want. We don't know a whole lot about risks. These are not really well studied in women. So the studies that we do have typically are, followed for 6 months or less. They're usually using like a topical patch that's not available in the United States. And, it looks like, at least from those small studies, that things are fairly safe in women. And when we look at men, of course, the concerns in men are always things like cancers, prostate and testicular cancers, and cardiovascular disease. Some of the newer evidence suggests that it may be safer in men than we had originally thought. But there's really still not a lot of data on women. So it's not something that I start with. The argument I think a lot of people make who do a lot of testosterone therapy is that, we would offer this to men. We care more about, men's quality of life, it seems, than we care about women's. And I agree. There's a lot of things that we do for men that we don't necessarily do for women. But I do think it's more of a conversation. I do think it shouldn't be your testosterone's low and you need testosterone. It should be a conversation about the risks and benefits. And just because somebody's male partner will take anything at any risk to improve their sex life does not necessarily mean that the woman wants to do the same. And so it's really a conversation about risks and benefits. When I'm starting someone on a hormone replacement therapy, I always start with estrogen and then, of course, progesterone if they have a uterus to protect the uterus. And then even if they've come to me for testosterone, I say, well, let's just wait on that. Let's see how you feel first with the estrogen, because a lot of the symptoms that they're having in terms of the fatigue and also the libido and energy, those are going to improve with the estrogen alone, which are much better studied. We know the risks and benefits in women of estrogen and progesterone much better than we know testosterone. And then I say, if you're still having very bothersome symptoms, then we're going to consider adding a topical testosterone. But that can get a little bit trickier.
Is it trial and error, really? I mean, are you measuring testosterone? I know we talked about labs a minute ago, but do you check testosterone levels in women at all? Is there any value in that?
I do check them initially, but again, the initial is really more to rule out the other things, particularly in the perimenopausal person, to see if it's a PCOS issue or something along those lines. If I'm supplementing testosterone, which again, I don't start with, so it's not the majority of my patients who are on testosterone, but if I'm supplementing testosterone, then I will check the levels, mostly to make sure that they're not getting crazy high. There's no set therapeutic levels for what a woman's testosterone should be. So it's not like you're titrating a dose to a specific level. It's more like, okay, well, what's the normal range of what a woman should have? And I do have some patients who are on the pellets and other things, not that I've given them the pellets because I do not do that, but who have come in on pellets, and sometimes their levels are 3-4 times what a normal, female should have in terms of a testosterone level. And I don't think that's where anybody needs to be.